Mr. Speaker, I rise for a point of personal privilege.
The gentleman may proceed.
I rise to address an issue today that we've all heard a great deal about, something that's very important to me. The opportunity for Virginia to move forward by providing health care for individuals earning up to 138% of the poverty line. Many of them working every single day, but at low-paying jobs that make it extremely difficult to put adequate food on their family's table, to pay their rent, heat their homes, provide medicine for their kids, let alone health insurance. These are your friends, your neighbors, and mine. Often, these people are forced to make choices between these necessities. There are an estimated 400,000 Virginians, including 84,000 children and 33,000 veterans in just such a position. It is clear that all of our communities would benefit greatly from healthier residents. Moreover, by avoiding the need to visit a hospital emergency room for routine health care or waiting until a minor health issue leads to a more serious condition, these individuals could receive more cost-effective care in the community setting. This will dramatically reduce the current strain on overused hospital facilities and the accompanying financial burden placed on those who truly require hospitalization to cover unpaid expenses for the uninsured. Today, Virginia is losing approximately $5 million a day, $5 million a day in federal funds that have already been set aside for this expanded coverage, $5 million a day. The economic benefits would go even further. However, with the addition of some 20,000 new healthcare-related jobs over the first few years, and as many as 30,000 jobs overall, these jobs will create additional tax revenue for the state, making greater resources available for other vital services as well. Without Medicaid expansion, more facilities like Lee County Regional Hospital will continue to close, leaving more rural residents of Virginia without access to needed care. These dollars can make up for other loss of revenue that perhaps keep their doors open. It's no surprise that our most prominent businesses, the Virginia Chamber of Commerce, hospital groups across the Commonwealth, social organizations, and bipartisan leaders throughout the state all consider this the most important issue facing us here at the General Assembly this session. However, that being said, I could stand up here and recite number after number, study after study, and even the latest revenue estimates. But you know what? Several real-life Virginia stories can better illustrate why we must capitalize on this most important opportunity for the benefit of all. Take Allison from Giles County, a mother of 3 who suffers from seizures, but she cannot afford health insurance. Although she earns less than the federal limit for a family of 4, the lower cap set by Virginia places her in a coverage gap. Her $750 monthly medication expenditure is currently being covered by a free clinic. But she worries constantly, minute after minute, day after day, that this may not help her and may not continue in the future. Shouldn't she have access to affordable health care? Jesse in Leesburg is a 59-year-old former Navy Seabee, currently making $11 an hour as a home health care aide. However, he himself cannot afford insurance for necessary dental work or a desperately needed colonoscopy. Julie in Newmarket had to return to work after the death of her husband. Unable to afford medication for severe asthma, her condition worsened to the point that she no longer could hold her job. The Shenandoah County Free Clinic provided her asthma medicine and then hired her as a medical assistant. She summarizes her experience by saying, quote, "You can't work if you can't breathe," end quote. Allison, Jesse, Julie, and so many other people we all know represent the real stories behind the statistics we hear day after day on the floor. Their experiences are all too typical and occur in every corner of the Commonwealth and in every one of our districts. Yet some of these people cannot wait for the next study or the next audit to be completed. They literally cannot wait. We have the chance to do something remarkable here, provide potentially life-saving care for those who have lost all hope of a normal, healthy life. I urge all of my colleagues to move forward on expanding health insurance coverage for so many working, uninsured fellow Virginians now, now, while there is no cost to Virginia citizens for 3 years and only pennies on the dollar after that. After the fact, Mr. Speaker and ladies and gentlemen, we'll all be able to look back and know that we truly made a difference in the lives and the communities of so many. Thank you, Mr. Speaker.